imagine this. You're going to work, you're enjoying going on your daily life, even having a meal. But suddenly, you try to take a breath and it's actually difficult. You find this tightness in your chest. Now, what are you going through? For most of us, these are the symptoms for asthma. Now, asthma has affected an estimated 2 million people in Malaysia, but only 6% of that 2 million have this disease under control. Now, in Health Matters today, we'll be exploring asthma and also talking to a doctor and also a patient about asthma and how to handle asthma. Now, a lot of us don't even know that this little guy can actually save your life. So join me in today's episode. This is Health Matters with me, Dishen Kumar. Let's start off with asthma. Everybody knows about it, everybody's heard about it, but what is actually, what consists that in that disease when you're talking about asthma?
So it's quite complicated because it's something that, like you say, everyone has heard of, and even doctors, they come across asthma all the time. But to actually diagnose it is quite difficult sometimes because unlike things like hypertension or diabetes, you may have situations where you've got very fixed numbers, and if it goes above a certain number, you have a diagnosis. With asthma, it's very much a case of diagnosing through clinical features, so based on your symptoms. Typically, you get someone who has got an underlying problem with their lungs where there's a lot of inflammation, and because of the inflammation, you develop some form of sensitivity. So then you become a little bit more reactive to things that are inhaled, for example, allergens in the air, bad air quality, so tobacco smoke, diesel fumes, things like that. You may be more prone to some sort of reaction. And sometimes you can also find that there's a difference between the symptoms between daytime and nighttime. So when you get these kind of symptoms, then it tends to raise the question whether you may have asthma. So no simple answer as to what exactly it is, but the underlying theme is that there's inflammation in the airways, and as a result of that, you're more sensitive to things around you. So sometimes a prolonged cough, for example. So sometimes when we talk about asthma, you think of a kid who is wheezing. You may think of someone who's got some tightness to their chest. And some people have this myth that it cannot be diagnosed as an adult. So actually you can have asthma at any age. Typically you get it as children, but you can get it as an adult, and more recently we find that we actually have a large number or an increasing number of the elderly who also have asthma. So it can happen at any age. So that's one thing. And like I mentioned, like a chronic cough, for example, that can sometimes act as asthma as well. Now the flip side to that is sometimes asthma is overdiagnosed. So you hear someone with a wheeze or someone who has got some sort of tightness, and it could be other things. For example, if you've got tightness down here, then it could sometimes even be reflux because you've got acid going up which causes some spasm. Sometimes it's actually issues with your nose where you've got stuff dripping down into your airways, and as a result of that you have a prolonged cough. So once again, it's a bit complicated, and that's why having a good clear history is very important. So what happens is, think of your lungs as consisting of various tubes. It's like a pipe, or rather various pipes. So the lining of the pipe becomes thickened. That's where the inflammation occurs. And if you imagine, if it becomes too thick, then it becomes more narrow. That's why sometimes you may find that it's a bit tight. It's like you can't expand fully. And sometimes when there's a lot of inflammation, it produces a lot of secretions. And that's why sometimes people can cough up phlegm because you've got stuff coming up on the lungs. Now, alongside that, you may also find that the cough is there because you're reacting to things around you. So those are that's the process that tends to occur in order for you to get those symptoms. Now, if it's bad enough, then that narrowing becomes very, very tight, and you may find that actually you can't take a deep breath in. And at that stage, sometimes even taking your medication or inhalers won't help because everything is too congested. Then you rush in, you get admitted and things like that. So that's where things become very critical.
Okay. Now talking about the inhalers, because you talked about if it gets very tight, you really can't use the inhaler. But how important is that to have by your side when you have an attack?
Very important. Now, in order to get to the point where it's so tight that even the inhalers don't work, there would have been preceding moments where you could have intervened.
Okay.
And inhalers, they generally fall into two categories. You've got what we call relievers. So inhalers that when you take it, you feel an immediate relief. It opens up your airways, but typically that lasts only maybe an hour or a couple of hours at most. And typically we find that most patients use something called salbutamol. So the blue inhaler, that's your reliever. Now there's a whole range of other inhalers that we label as either preventers or controllers. And as the name suggests, by using these regularly, it will control that inflammation. And not only does it mean you may have normal, straightforward quality of life, but it also prevents the inflammation from getting worse and prevents the asthma attacks that we're worried about. It's a spectrum. So you've got folks who have very straightforward asthma. You may have maybe an attack a year. Then in that sense, it may not actually be practical or even cost effective to actually use an inhaler every day. But I think carrying that blue inhaler, the reliever, around with you is very important, because you never know when you may react to something in the environment. So at the very least, carry that blue inhaler around with you. Of course, we've got people at the other end of the spectrum where things may not be very well controlled, and you may not need just one extra inhaler. You may need 2 or 3 inhalers, you may need certain types of tablets, you may need other types of medication on board. So that spectrum is quite wide, but at the very least, you should carry a reliever around with you. I think that the basics remain the same. So at the very basic, the patient needs to take the inhaler regularly, but also correctly, because there are lots of types of inhalers out there. It's confusing as heck, and actually getting the medicine from the device into your lungs can be complicated. So the first and most important thing is using the right inhaler regularly, but also with the right technique. And we should spend lots of time actually talking about that when we meet our patients. Now, remember how I said asthma is like a spectrum? Now, in that spectrum, people may behave differently, and you may have different types of characteristics. So not all asthma is alike. And you may find that certain people will respond better to certain types of medication. So there are tablets and medication out there that work for certain groups of people. And as we learn more about asthma, as we learn more about these medications, we find that we can make things more personalized. So down the line, if things don't work despite the basic treatment, then there are various options. But these differ, and they are very much dependent on the individual. The goal of all asthma treatment should be normal quality of life. So there isn't really any excuse for people to not do what they are normally supposed to do. This applies for, once again, maybe about 95% of cases. So that very small number, of course, if it's too severe, then it's a different situation altogether. But if your asthma is limiting you and it's stopping you from doing things, then it means that it's not well controlled. So it goes back to, are you on the right medication? Are you using it correctly? And are you using it often enough? Once you've reached that goal of being normal, of being able to do things as any other human can, then we can then try and bring down the medication. So let's say you need 3 inhalers to get to this level. Once you're there, as time goes by, you may try to bring it down. So it's very fluid, very dynamic. It varies actually. Okay. I've had patients who sort of sprayed on one end and then kind of like just breathe it in kind of thing. Okay. But the onus is on the doctor or the nurse to explain these things to the patient. Because if I want to give you a complicated device without any instructions, then of course you're going to kind of try and use whatever method that comes to mind to use it. So in this day and age, of course, you've got the internet as well. So you've got things on YouTube, you can quickly look at things. But really, it's about getting down and spending time with the patient to actually figure out how to use it properly. And then you may find that the treatment needs to be changed. Because, for example, some of the inhalers require you to press the button in order for you to get the medication in. But if you're fairly old, or if you've got arthritis, you may not have the strength to do it properly, or you may not have the strength to actually hold your breath and breathe in. Then you may decide that, okay, let's try a different inhaler, or sometimes you use something called a spacer, so like a chamber device where you spray the medicine into the chamber and then breathe things in. In fact, this one, yep. So like this thing, you can put an inhaler here, press it in, and then you just get silence and breathe. So that, it boils down to the fact that you need to spend time, get the patient to understand the rationale of using these things, and then get it used regularly. And sometimes we get parents coming in telling us that actually we don't want our kids to play sports or participate in sports, so can you give a letter saying that they should be excused? But the reverse is true, because you want people to actually be more physically active. More physical activity actually improves the health of your lung. There are no supplements, there's no magic tablets to make your lungs healthy. It's good old-fashioned physical work. And I remember reading about our national swimmer, Welton Sin. So he apparently took up swimming because he had asthma. and he's obviously done very well from it. But it just goes to show that actually you shouldn't let the asthma control you, but rather you should do what it takes to control the asthma. The reason someone might feel that way is it may be that because they need something stronger at that point in time. And like I mentioned before, sometimes they may be referring to the blue inhaler. So if you're using a blue inhaler frequently, then actually it may mean that you're not addressing the underlying inflammation and things are getting worse. And after a while, if there's too much tightness to the tubes, you may find that it doesn't make any difference. So it may be how you approach things that make a difference. So by right, in theory, your blue inhaler, the reliever, you shouldn't be using it more than twice a week. If you're using it more often than that, it tells you, or it tells me as a doctor, that the asthma is not well controlled. If someone's buying more than one inhaler in a year, that tells me that you're overusing a blue inhaler. And to me, that's a warning sign. It means that you need to use your controllers better, or I need to improve the degree or the dosage of the controller inhalers so that you use less of the blue ones. No, unfortunately, once you have asthma, you're kind of stuck with it. What changes is the susceptibility to things around you. So as a child, especially when you're growing, you get exposed to all kinds of new things. You get attacks, recurrent wheezing episodes, and then eventually the frequency goes down. But you do find that some people eventually, as they get to a certain stage in life, that some of the symptoms come back. It's just that because the threshold has changed and because the immune system has been modulated as well, they don't get it as frequently. But it's more about things being less severe rather than it being completely gone. Because you get folks who have got life-threatening episodes, who get admitted needing ICU treatment and things like that, but having come off it and then having been on the right treatment, they actually can get better. So the ones who are very difficult to control, the ones who need multiple medication and things like that, the numbers are actually very small. The vast majority of folks are actually folks who need just a little bit more attention when it comes to the type of medication, and once again about the regularity and the accuracy of how they actually get the medication in. The preventers, yes. So the relievers, the blue one, they don't. But the preventers or controllers, they have a tiny amount of steroid in them. Because steroids are the best drugs when it comes to decreasing inflammation. But I think going back to what you mentioned about myths, sometimes people are worried. They think, oh my god, steroids is going to destroy my kidneys, it's going to make me fat, blah, 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 blah. But steroids, once again, it's a group. And they're different types. You've got inhalers, you've got tablets, you've got even IV steroids. Now, the side effect profile of each are actually quite different. If you were to use tablets, for example, and you use it frequently or often enough, then yes, you'll get all the side effects that you will worry about. But inhalers, they tend to go straight to the lungs. And the dosage and the formulation is extremely different. So you actually get very minimal systemic effects. It goes to the lungs, it helps the inflammation. And the steroid inhalers are the ones that save lives. They are the ones that actually control the asthma. In fact, by controlling the asthma with inhalers, you actually reduce the risk of requiring the tablet steroids. So if you don't use your inhalers properly, you might end up needing more tablets, which we use for more severe cases, and then you end up having side effects. So one of the reasons for using the inhalers is actually to avoid all the side effects from steroids. If we need to use it, we don't want to use it unnecessarily. So if you have a cough that's been going on for more than 3 weeks, I think you should see a doctor. Because asthma aside, it could be something else. It could be TB, it could be cancer, it could be anything. But if you do suspect yourself or even your children as having symptoms in keeping with asthma, then do see a GP. Most primary care doctors, most GP doctors, they're very familiar with these conditions, these symptoms, and if necessary, they can then refer the patient on to a specialist like myself or somebody else. The other thing, of course, is the information online. You mentioned earlier on about the misinformation, and we've gone from not enough information to too much information to the point where we can't figure out what's right and what's not. So go to very clear, trusted sources. And we have an organization called Asthma Malaysia. So if you go to asthmamalaysia.org or you follow the Facebook page, you'll get lots of information there that we hope is very geared and actually directed towards the Malaysian population. There are other very good asthma sites as well. There's Asthma UK, Asthma Australia, and they will give you very good details about the symptoms, what to do if you're worried, the different types of inhalers, and basically all of this is geared towards empowering the patient so that once you have asthma, or once you know you might have asthma, you're not afraid. You don't get held back by all these myths, and you can actually have a normal, decent quality of life.
welcome back. This is Health Matters with me, Dishen Kumar, and today's topic we were discussing earlier with Dr. Helmi is asthma. Now, in today's show, in my shows, in all our episodes, what we try to do is show you perspective. So one of the most important things is a doctor's perspective, but now we are trying to show you a patient's perspective in dealing with asthma. So today with me is Doctor. Could you introduce yourself?
Hi, my name is Katiana Azman and I am the resident child psychologist at Pantai Hospital KL.
So the doctor is the patient now?
Yes.
Okay. So let's start off with asthma. When were you actually diagnosed with asthma?
I was diagnosed as a child. I think I was about 2 or 3 when I first had problems. I've had pretty much childhood asthma. I think that's what they classify it as.
Okay.
And it, pretty much my whole life.
Okay.
Yeah.
So when you actually was diagnosed, was it a very bad episode that you had when your parents were thinking like, oh, there's something wrong and things like that?
I think my parents were not completely too surprised because asthma does run in my family. So I had a lot of people in my family who were diagnosed with asthma. So when I started, if I recall the story I was told, when I started having problems with asthma attacks and just an allergy to dust and things like that, my family were not too stressed out because they'd seen it before. But I think having a diagnosis of asthma at a very young age, especially with kids and you're exploring the world and running about, it was a pretty difficult thing to live with at that age, I think. So yeah, they were a little bit stressed out, but they did a really good job of keeping me away from things that I'm not supposed to be a part of.
Talking about keeping you away from things, one of the most common misconceptions is if a person has asthma, they can't really do physical activities.
Yeah.
Dr. Helmi actually talked about, he said, no, that's actually not true.
Yeah.
Did you actually go through that? Were your parents like, oh no, she can't really do
No.
that?
I think that is a common misconception. Of course, there were people in my family, especially from the older generation, that were just like, no physical activities.
They can't do this,
they can't do that. No swimming. You can't catch a cold. There were all of these, old wives' tales of things. But I think my mom did a really good job making sure to not confine me to anything, and just let me try everything. So I personally found, very activities that required a lot of exertion of energy, a little bit more challenging. So running and things like that were not really my strengths. But I did ballet for 10 years. I was in Taekwondo. I made it up to red belt. I represented my state for field activities, so not track but field. And it was pretty manageable. And I think as I got older and was able to build up on my stamina, it did become a bit easier. I'm not going to be a cross-country runner or take on Usain Bolt at any point in time. But, doing physical activities was absolutely possible. And having pets, I think that's also a thing, right? I grew up with a house full of cats. And so having pets was, at least for me, not a challenge. But dust was. That was always a trigger for me. So if we ever, I remember when I went off to college and I moved houses. That was bad. So being exposed to lots of dust does trigger me. So that is one thing that I do try to stay away from. So I'm a bit OCD when it comes to cleaning and things like that. But physical activity and stuff was pretty easy to get around.
So as a working adult now, do you find that is there a lot of challenges for people who actually have asthma? Because there's this the thing with Malaysians and things like that, if there's something wrong with someone, you will be diagnosed by everybody else as he has asthma, he can't really do this, he can't really do that, she can't really do this, she can't really do that. So as a working adult, there's a lot of people. The interesting thing about asthma is you can get it anytime in your life. It's not that you only can get it when you're young and things like that. So what are the challenges maybe you yourself face, like you're just at work all the time, you really don't get to use an inhaler that much and things like that? What are the type of things?
Well, I think it's in terms of convenience, I think that the delivery system for medications and for interventions with regards to asthma now are pretty good in the sense where they are easily accessible, they're quite portable, you're not lugging this big oxygen tank everywhere. So in terms of it impeding on your daily functioning or your social functioning, maybe not so much. But again, I speak from the perspective of someone who doesn't have a very severe form of asthma. It does limit you if you are, for example, engaging with a group that's very physically active and stuff like that. So yeah, in those environments.
And you're a child psychologist,
Yeah.
so if children are, or jumping around.
Of
and this
course,
and that. You actually have
yeah.
to follow them and does that
Exactly,
affect
yeah.
you?
So, you know, I'm always on the ground trying to play with the kids, and you know, and sometimes it's difficult when kids come in and they're not well, and I'm having to stay relatively within their personal space. A lot of the time I catch the bugs that the kids have, and you know, for me, if like I said, if I catch a cold, I will likely have an asthma attack. Or a couple of actually about 2 years ago, one of my patients had a very severe upper respiratory infection, and I caught it. And it was just, yeah, it was really difficult for me to kick off. And you know, and for me, especially working in an environment where everybody is often ill, that's why they're in the hospital. So I think it really depends on the type of environment that you're in. But being a working adult, you know, so long as you kind of know what triggers you and what to avoid and how to get around it or to medicate it if it happens, it's pretty easy. But you know, it's like, for me, like, I have constant control of the air conditioning. Like, you kind of just have to adapt. And then, you know, and after a while, it just kind of becomes a part of you. But I imagine that this is a lot easier for people like me who've grown up with it. But like, for example, my mom was diagnosed with adult asthma. So she was only diagnosed in her 50s.
Oh, wow. Okay.
And so the adjustment for her was a lot harder because she'd gotten so used to being very active, and she's an interior designer. She goes to construction sites where they build things and there's cement dust everywhere. So for her, the adjustment was a lot harder because it came at a point where she'd gotten so used to doing all kinds of things. So I think it kind of depends on, you know, when you were diagnosed, how severe your diagnosis is. But at the same time, if you know what triggers you, you know how to work around it, you know, it's all doable. But yeah.
And that's a good thing.
Yeah.
Okay.
Yeah.
All right. Final question for you. What would be your advice for working adults right now? What would be one thing they can do to try to handle asthma, or even people at home watching this, if they have or just been diagnosed with asthma? What are some of the things that you can actually tell them, like, hey, it's okay actually?
I mean, I think that asthma is absolutely not a death sentence. You know, it is something that can make your day-to-day life difficult, but only as much as you allow it to. I think that you should not feel that you're not entitled to having as active or as exciting a life as you want to have. There might have to be accommodations that you have to make. You might have to have your inhaler on you, or you might have to avoid certain things. But that doesn't mean that you have to rob yourself of the experience entirely. So figure out, you know, have a very open conversation with your doctors. Figure out what your triggers are, figure out what you need in order to be able to function at the level that you need to, and then go from there. But don't feel that you have to be boxed in a corner and you can't live life, and you know, you can't have ice cream even though all the old people say you can't. You can. You know, and because at the end of the day, every illness, I feel, at least from a psych perspective, every illness drags you down only as much as you allow it to. And so that's kind of how I think about asthma too.
All right.
Yeah.
All right, thank you so much. This has been Health Matters with me, Dishen Kumar. Today's topic was asthma, living with asthma, and also asthma as a disease. We talked to both doctors, one doctor as a patient and also Dr. Hilmi, who actually talked to us about asthma. I think the most important thing that we can take from this episode is asthma is not a death sentence. You can still have a good life, a good quality of life. You just need to know what triggers you and also what type of medication, and also use your inhalers properly. This is me signing off. This is Health Matters with me, Dishen Kumar. I'll see you in the next episode.